that's more like it. Thank you. I want to welcome everyone to this year's, I guess this is 2018 graduation banquet and party. I believe this is the 34th banquet we've had, and I think this is the 30... No, it's the 34th banquet, 39th graduating class. There was not, they didn't, I don't think they had banquets before I came back. But it's the 39th graduating class and the 34th year that we had banquets. I think earlier they took the chiefs out to dinner and so forth, but didn't have the banquet. I want to welcome everyone. I want to especially welcome the families of the graduating residents, and Dr. Hardeman's going to give you time to introduce your families later. I especially want to acknowledge Dean Garcia. As always, we appreciate her being here because she's been a really good friend of our department, and she's been a good advisor and counsel to me and lifts me up when I get kind of discouraged a little bit. And of course, I want to thank our guest speakers this year, Myron and Dr. Burgess, and again, John Hardeman will say more about that later. And I do want to give kind of a special acknowledgement because I'm very, very proud of all of the people here, but I'm especially proud of Alex. And again, I want to comment that Alex Martinez, for those of you who don't know, and I'd be surprised if anybody doesn't know by now as much as I talk about it, as you know, Alex was just elected he's currently the Vice President-elect of the International Association of Oral Maxillofacial Surgery, and will become the President in 2022. So in the year 2022. You know, that's a really big deal. He's president of the whole world. So I thank everyone in the department who works with us in the department. We have a terrific department, and as I say every year, and I'll say again, you know, we're only as good as our weakest link. Unfortunately, our weakest link is pretty good. And everyone, you know, every person here accounts for the success of the department, and I really appreciate it. And I know I probably don't thank you enough, but I do want you to know that I thank everyone's efforts for us having another great year. It's been a good year in the sense that this year I think we've had more residents come back for the mock boards and the banquet that we've had any previous year. I believe I think we probably had 15 former residents that came back. They're either here tonight or here for the mock board, and that's a good number. And hopefully we can, this will be the stimulus to start this thing growing even more. So I think I've recognized everybody I'm supposed to recognize, and I'm going to turn it over to you, John, for the rest of the getting people to the meals or doing what we're supposed to do, because I don't know what we're supposed to do at this point.
That's fine. Thank you.
Oh, and I do want to thank John Hardeman because he's going to be speaking a lot tonight, and there probably won't be a time for anybody to thank him. And again, I'm really appreciative of everything John does, and John makes my life a lot easier. Thank you.
Thank you. Yes, sir. My pleasure. Welcome, you all. We're so glad to have you here tonight. I want to welcome all the families coming from our residents. They've worked so hard this year. We're going to talk a little bit more about them. I think what we'll do now is we'll start with dinner, and we'll make our way starting with the head tables here, the residents and our guests here. And then about 8:30 or so, we'll start with the formal program and do the recognition and certificates and everything. So let's go ahead and start with Clay, your table, and then Ryan, and then John, and get you guys going. Then we'll just kind of file in from there. Okay? Great. Talk to you all in a few minutes. Our residents introduce their families at their tables. Clay. Okay, I'll start with Ryan. Ryan?
To my left is my wife, Martha, who is in August we've been married 10 years, and she has been a trooper and been full time. It's my mom, Joyce. She came down from Kentucky to spend the evening with us. Dear friends, Mary and Chris Coombs, and then Katie and Chris Hamrick, and Nancy.
wife Sarah, and my in-laws Sam and Cheryl. My parents here, Stephen and Hamrick, my brother, his wife, Chris and Catherine, my fiancée Raquel, and her brother and sister Alex and George.
Well, this is the 39th graduation. I think Jana just counted, this is our 4th now that we've been entitled or privileged to be part of it. So I just want to thank you all again, and welcome you all tonight. We're going to have some nice awards and everything, but let's just do some recognition of our guests. And so on behalf of Dr. Dolwick and the department, we'd like to just recognize the guests and the families and the staff that are in attendance tonight. Certainly, Dr. Garcia, we're grateful for your presence. We're grateful for your leadership at the school. Thank you so much for being here. Our son Adam is with us tonight as well, so welcome Adam again. This is a team, and it's a team not only of just oral surgeons, but of all the faculty and staff here at the university. So I'd like to just, ask if you are a faculty member here tonight, if you could just stand and let us recognize you, and then we'll do some other formal introductions later. So if you're faculty here, courtesy faculty, getting ready to retire, whatever it is, just stand for us, please, just for a second. So like most celebrations, it's not just a night, it's not just a couple of days. We've actually started this off about a week ago. And so one of the new traditions for the residency is the Chief Lectures series. And we've had everything from astrophysicists to microbrewing. And so this year we had a very fascinating lecture by Mr. George Burgess. George is here with his wife Linda tonight. George is the world's foremost expert in sharks and shark attacks, and he gave us a fantastic lecture. He's even schooling us tonight a little bit on things, and so we welcome you here, George and Linda. Thank you. Now our speaker for this weekend, and for one of our examiners for our mock awards, we've been so privileged to have Dr. Myron Tucker. Myron comes to us now from just outside of Charleston, but we spent time at University of North Carolina, and then for 11 years it was in private practice, for 19 years in Charlotte, and he came and spoke to us this morning on orthognathic surgery, both in the growing patient, but also his 40-year perspective of orthognathic surgery and how it's changed. So those of you who were there this morning just really were in for a treat and a lot of education. So we'd like to honor you tonight. Myron, if you would come up, we have a few things for you. Better pictures. Okay. So we have a plaque, and the plaque says, "With sincere appreciation of Myron Tucker, oral maxillofacial surgery graduation, June 30th, 2018. That's for you.
Okay.
Let's get a picture here.
Hey, let's see the plaque.
Oh.
Okay.
But don't go away. That's not all. So, one of the, the Gator tradition is strong here at UF, as always, and we have a local photographer who has provided such great pictures and things for us. So we have your own Gator to go to your house there. It's called Paddling in the Moonlight by John Moran, and so we're just fortunate to have you here and hope you accept this and enjoy it.
Oh, thanks so much. Thanks so much. Well, I appreciate the opportunity to be here. I just want to take a couple of minutes to congratulate the residents. It's such an honor to be here. Frank has been such a hero of mine, and I work for the Osteoscience Foundation, travel to see all kinds of residency programs, and this is one of the elite programs in the country. So, Clay, John, and Ryan, if you would just stand. It's an amazing feat that these guys have accomplished. It's an incredible achievement in their lives, and the sacrifice they've made, the work they've done. and the support that they've had from their family is just incredible. So y'all really deserve it. I have a little something that I say to a lot of my residents I've associated with when they are finishing their programs. It's a little acronym. I call it CARES, C-A-R-E-S, and just some things to think about as you head off into this new phase of your life. C is for continuing education. You've been on an academic marathon. Every day you get stuff, you're piled on all the time, and I think it's reasonable to take a couple of months off. Don't read a journal, just relax. But ultimately, you got to get back into it. This is just the start of a very long journey, as I explained this morning, and what you're going to learn over the next 30 or 40 years will just make what you've seen in the last 3 or 4 or 5, 6 years seem very small. So get involved in continuing education. A is for association. You need to be involved in your associations, everything from your state level, your local level, your community levels, all the way up to the national, AOMS, ACOMS, whatever it is. Stay involved in that. R is return. I think you need to return something to your community. You have incredible talents, and don't worry about the money all the time. Somebody comes into your office and you can get them out of pain, spend a day a month at a community clinic or something. Just return something to your community with the talents that you have. E is for everyone that's important to in your family, friends, people who have supported you that you've probably mostly ignored for the last 4 to 6 years. So try to reconnect with them and do things for them. And the last thing is S, self. Everybody's going to want a piece of you for the rest of your life. And some days you just need to go fishing by yourself or go sit on the beach and read a book or whatever. So make sure you try to incorporate all of those things into your life. Woody Allen said that the future of life holds tremendous opportunities and also some tremendous pitfalls. So the goal is to avoid the pitfalls, to seize all of the opportunities, and get back home by 6 o'clock. So we can do that. Thanks for having me here. It's been an honor.
Thank you, Bart. Also, we have two that really come a long way. We have Alex Martinez and Hugo Martinez, who have traveled from Mexico. We're glad that they're here. Thank you and welcome. Thank you for coming back. If we have any of the courtesy faculty who were volunteer in the student oral surgery clinic, I don't know if anyone's here, but please rise if you would, because we'd like to recognize you. Anyone who's volunteered? Okay, wasn't sure. I'd like to recognize the spouses and the families. You guys have really given, you have sacrificed, and you have supported. And I speak to my wife in that way as well. It's a long road, and we're so proud of you guys for succeeding, but we're so proud that you're surrounded by family that loves you and supports you as well. So I just want to welcome everyone there. And for those of you who are in the beginning parts of your training, there is an end. And it comes a lot faster than what you think. In the midst of it, it seems like it's a long time, but there is an end to it. I also like to recognize those persons who are just behind the scenes that really make this whole thing work. I need to recognize Patty and Connie and Mary Taylor and Mary Tomlinson and all of our front desk staff, all of our administrative staff, and certainly our fantastic assistants. I mean, they work tirelessly there. Diana, Shelley, we thank you for the services you provided for us. And Liz and Heather and Paula and Haley and Vanessa and Reagan and Christy, you guys work so hard for us, and sometimes we don't stop in the midst of all of the hurriedness of the day to say thank you. And so from all the residents here, I'd like to just join me in an applause for them. So thank you so much. the other side is, of course, the hospital, and we have two gentlemen that are in our OR every week, and we're so proud to have them. Tonight, Dan Mesa is here with his wife Denise. Dan, just stand up so everyone can see, or wave. Thank you so much. Dan he's our guy. I mean, he makes sure the equipment is there. He busts on the dental students when they're haven't scrubbed right. It's just a pleasure to work with you, Dan. You are a true professional, so thank you so much. And again, I just need to really recognize my wife, Jan, who just, without her continued love and support and just encouragement, that I wouldn't be here today. And I over the last year, we have new faculty. Dr. Bowers joined us a year and a half ago, so you're not new anymore. But we're happy to have Danielle Freeberg-Hoffmeister. Danielle, would you stand for us, please? Where are you, dear? There we go, thank you. And Carla Guevara. Carla, if you stand, thank you. Young faculty like this I mean, that's the promise of the future of our specialty. I mean, we love your encouragement, we love your enthusiasm, your skill, and all of that. So we thank you so much for being here and being part of our team. We have new residents. I'm going to introduce our new residents coming in. First of all, Richard Tamayo. Richard, will you stand for us, please? Where's Richard? Richard has done such a great job this year. He's a UF graduate. He served as our intern this year and has matched with us in our 4-year position. So Richard, we're glad to have you. And Diley Diaz. Diley, can you stand, please? Diley is another UF graduate, starting with us this year, and so we're happy to have you as well. We're going to work you hard, just like Richard. And Spencer, where are you? Spencer, can you stand? Spencer Blumberg. So Spencer, we're happy to have you part of the UF family again. It was interesting this year, we matched all 3 UF graduates, which doesn't happen all the time, but certainly we got 3 really fantastic young people here. We have an intern this year, Holly Malinowski, comes from Detroit. Holly, where are you? Would you stand, please? Thank you. Holly's here. And of course, you know, the reason that we're all here tonight is just to recognize our graduates. And so we have some certificates that we're going to award and recognize everyone with. The first one is for Richard. Richard, if you'd come forward for me, please.
Okay.
And this award, Richard, is the certificate for completion of oral maxillofacial surgery internship. You worked so hard this year, bud. You've done such a great job. I'm so proud to be part of it. I'm so happy that you're here with us today. So let's come yours. Let's step over and get a picture.
Okay.
Great. Thank you. Dr. Bowers, would you like to come up and present the SOS award, please?
Okay.
Having joined last year, I had the honor when Matt Dennis retired to take over the SOS clinic. I also get to enjoy the fact that I get residents on Monday, implant center on Tuesday, and then students a couple of days a week. So there's a bit of diversity after leaving private practice. The one thing that I can just ask, because I could go on and give y'all stories because you're used to that in the clinic every day, but I would ask that you keep the same enthusiasm that the chiefs have had at 4 o'clock in the afternoon when you get a call from a general dentist that just shoved a root up into the sinus, that you have when I come over to the clinic and say, hey, I got somebody just shoved a root tip up in the sinus, you want to get it out? Because y'all have always been there for us when we get bogged down. You come over, you help the students out, but not only that, you help teach them. You do it professionally. You don't walk over there and you know, say, what'd you do this time? You really try to lead them through it, and you've set the bar high for the chiefs that are coming after you to continue to work with the students in that manner. For that, I want to personally thank you.
Okay.
Clay. Ryan. It says for outstanding contribution to the Student Oral Surgery Clinic, 2018, but it's really been a lot longer than just 20 years.
One more. Okay.
Because it's safe now. It is. And John. It says the same thing.
Okay. Okay.
Thanks, Tom.
Our program is a lot more than just teeth and titanium. We certainly do a wide variety of surgery from TMJ to trauma to pathology, but one of the things that we really get a lot of experience of is in the Center for Implant Dentistry. And we are so privileged to have Dr. Will Martin, Dr. Luis Gonzaga as our prosthodontists. They have a core curriculum that works so well, and it gives training to these young men and women that honestly I don't see anywhere else in the nation. I spent thousands and thousands and thousands of dollars in continuing education to learn what these guys bring to them every week or so. So Will and Luis, if you'd come up, please.
Okay.
Good evening. We'll make this quick. In the past few years, we've been wanting to leave our chiefs with a memorable gift from their time in the implant center. And we started to realize something this past year. The transition for integrating the digital workflow into implant dentistry has gotten really big. Integrating digital technology, 3D printing, CT guided surgery has been a big part of the rotation for our chiefs in the implant center. So the previous gifts we used to give out are no longer valid. So Luis and I got together and we're like, what can we give them that will be kind of different and they can kind of get a kick out of in their practice? So we designed this beautiful plaque right here, but there's nothing on it. So using the technology we have, we 3D printed a mandible, so it slides on there, and there's a CT guide on it. So we thought maybe you would put these up in your consultation room, and it'll be a conversation piece. It reads, this one is for John, CID Chief from 2017 to 2018. You want to come up and get it? Just don't hang from it. So this thing was entirely 3D printed. I really encourage you all to come up and see the technology behind this. You can't really even feel the layers to it. Brian. Oh, and also I forgot to tell you, we put the oral surgery logo in the floor of the mandible.
Okay.
So Mo's logo is in there.
Okay.
And Clay.
Is that their mandible?
This is not their mandible. Hope you all enjoy it, and we look forward to keeping in touch every year when you come back and visit us annually at these great graduation dinners. Thank you.
Well, now we're going to recognize our graduates individually. Dr. Dole would like to come up and say a few words to them, and then I'll have the opportunity as well.
Okay.
Thank you, John. I'm kind of dying with the cold, and as most of you know, I don't talk much at this point because I get very emotional about this because these are like my children. And you know, these three residents, I can't really say anything funny about them because they just came to work every day and did their jobs. And did their jobs really well. There was no drama with them, at least not that I knew about. maybe I'll hear about drama from the younger residents after they're gone. But there really wasn't any drama. They were fantastic to work with. They're incredible surgeons, and they're going to have incredible practices. For John and Clay, I've known them now for 10 years because they went to dental school here, and they were part of the oral surgery interest group that I oversee. And I can remember back about, well, it was earlier than this, 6+ years ago, we had a party at our house, Brenda. We had a big cake, and Clay and John and Chris, a whole group of the students, because I think that it's the class of 212, is that right? The dental class of 212 here, we have 5 residents in the program from the class of 212. And so I've always viewed them as our Fab 5. And there's actually another student from that class in oral surgery at Oregon. So, I'm not going to say much more. You guys were just fantastic. It's been a great 10 years with John and Clay. And of course, there's always a special place in my heart for Ryan because Ryan's a Kentuckian. And I was so happy to have Ryan come join us. I think Ryan was the 2nd resident we've had from Kentucky. I went to school at the University of Louisville, and that kind of tarnished it a little bit. But it's been great. And so congratulations to you guys, and I look forward to watching your careers continue.
Thank you, Dr. Goldwick. Gentlemen, we have these chairs for you. As part of the tradition, what I'll do is like to have you guys come up and take a seat in your chair, and then we'll talk a little bit about you and present some certificates. Look at them, see how polite they are?
Okay. Okay.
Gentlemen, when I sat down to write this today, it was actually very difficult for me in that I have all these adjectives that can be used and will be used, but I couldn't apply any one of them to any individual because they're fitting of all of you. You have done so well. You have worked so hard. You have worked to train the young ones and bringing them up, whether it's lower residents or dental students or residents from other clinics. We're just so proud of the way that you've conducted yourself this year. It has been a true honor to work with you. Clay, son, you're hardworking. You are dedicated, certainly well-read and prepared. And it has been an honor to work with you. I started off with Clay in this rotation. We work about 4 months out of the year with him. And Clay and I started off together. And I tell you, towards the end of that rotation, I'm talking to Clay. He's like, "Are you going to let me scrub in?" He's like, "No." It's because he had it, and it truly did. He had it, and you are going to do so well. And we just look forward to your future.
Okay.
So. Clay, if you come forward, this is
Okay.
certificate of completion for oral and maxillofacial surgery residency. It's a secret handshake, okay? Ryan, if you'd come up, please, boy. So Ryan, again, exemplifies just professionalism.
Okay.
He's so organized. He's a great teacher. He really works well with the younger residents, and he's a very skilled young surgeon. So we know that your career is going to do very well. We just wish you the best, and we look forward to seeing you again. Come back. Thank you so much. And Maz. So Maz is kind of at first I thought he was like the quiet one. Every year we have kind of a quiet resident that comes up, and I didn't get to appreciate John's sense of humor until I started working with him. And so, I'm jumping all over this stuff. You're definitely a thinker. I like the way that you present with with an issue and you work through it. You're very skillful. So John worked with me in so we just finished working the last 4 months here, and really he was on autopilot. I mean, there was very little that I had to do to help him and correct him in just the little nuances of things. I mean, he's been trained so well by Carlo and Frank before him, and Tom and Danielle. You really truly were on autopilot, and so it was a pleasure to work with you. Good luck in your future. We know that you will do well.
Okay. Okay.
All right. So, as is custom, we have the opportunity for our junior residents to come up and speak a little bit about their seniors and their chiefs. I think we have a presentation as well. So, gentlemen, come on up.
All right, so for those who might be the first Banquet, it's kind of our opportunity to talk about all the chiefs and kind of about things we've learned and just some individual things about them. We're very, we get to spend a lot of time with the chiefs. This is a great year for us as fourth-year junior residents. Really get to learn a lot this year, and most of what we learn as far as our skills and knowledge, a lot of that is very dependent upon our chiefs. So I want to thank you guys just for your leadership and your teaching throughout the year, and I've learned a lot. But so kind of the way we're going to do it tonight, since there's 4 of us, we're each going to pick a chief resident and that we spent the most time with this year and kind of talk about them. And I think Chris is going to give a summary at the end. So I'm going to talk about John first. So John and I started out together and ended up spending the most time together this year. So as I was thinking back, obviously there's many things that I could talk about with John this year, but I found 3 things that I admired and respected about John that I'd like to share with everybody. The first being his composure. John was very cool, calm, and collected no matter the situation. So whether we were in a stressful situation in the OR, or whether he was explaining a difficult treatment plan to a patient, I really admired his ability to respond in an appropriate and effective way in all those situations. So I really looked up to that. Secondly, as Dr. Hardeman mentioned, was John's humor. I always look forward to either our mornings in the resident room or afternoons after clinic hanging out, because I knew there'd be full of laughs. And John was always the source of a lot of those and provided a lot of those. I also really admired his ability kind of in a difficult situation in the OR when everyone's a little high stress, his ability to come up with a witty or sarcastic joke to help kind of ease the tension in the room and get everybody relaxed and refocused. So I really appreciated that. Definitely made it fun to work with. And then lastly, John was a very disciplined person. I think, maybe one of the things about John that stands out the most when our residents think about his discipline might be his lunch menu every day. I don't know how he managed to do this. I mean, it takes a lot of discipline, but I think John ate the same thing for lunch for the last 6 years, and probably did that in dental school as well for the last 4 years. So the standard John lunch menu was baked chicken and broccoli. And if he was feeling a little crazy, he might throw some carrots in there too. But every day, consistently, that was John's lunch. In addition to that, John was always very on top of his schedule and his upcoming cases. Being his junior and kind of doing a lot of the workups, John was always aware of what cases that he had coming up, was always looking multiple weeks ahead of the schedule and was always right on top of things. He was very well organized and dedicated to his patients, so I really appreciated that. He helped teach me through a lot of the workups for the various procedures that we do, and so he was a great teacher and mentor in that regards. And kind of as a side note here, just along with his humor, John is also good at nicknames. So if you need a nickname, you can, kind of an inside joke there, but he's a good nickname giver. But anyway, thank you, John, as well as Clay and Ryan, just for your leadership and teaching this year. It's meant a lot to me. I've enjoyed working with you guys, and we'll miss you guys next year, but wish you the best of luck in your practice.
So, as Calvin previously mentioned, this is a little bit of a strange year here. We had 4 junior residents. So a couple of us got to spend quite a bit of time with a single chief. So I was lucky enough to get to spend most of my time with Clay. We actually spent 8 months together. Initially, I was pretty nervous about that. Clay is probably going to go down as one of the smartest, most gifted people to ever come through this program. An example, just during our weekly case conference, it's always a challenge to try and stump Clay. The attendings always try and ask us questions, and you'll hear echoes of "I don't know" until it finally goes around and gets to Clay. And I don't think he said "I don't know." I don't think it's part of his vocabulary. He was always correct and quoted probably about 4 authors who backed it up. Let's see. So Clay, he's just been a very detailed, gifted surgeon who settles for nothing less than perfection. And working with you, your confidence and abilities are second to none. And I'm going to do my best as I can to keep carrying on that tradition every time I step into the OR. Over these 8 months, I know you were probably nervous realizing you paired yourself with me for 8 months. But you honestly became an older brother to me who I'll continue to look up to throughout my career. And it'll be strange to operate without you after working with you for so long. I was trying to think of something, but to quote actually one of your favorite movies, I wish I knew how to quit you. And hopefully one day you'll want to reform the ham sandwich one more time.
All right, I'm Justin Stanford. I'm one of the 6-year guys. So Calvin, myself, and Ryan all started at the same time. I spent about 9 months with Ryan this year, and so I'm going to speak on him just for a moment. With the 6-year program, we kind of go to med school for a couple years, and then we come back. Coming back can be kind of nerve-wracking because you're basically with these guys that have been on service, and you've basically haven't done any hand skills for the past 2 years. And so I just remember starting and coming in and being really nervous, and Ryan kind of calming me down, taking me under his wing, and just kind of showing me the ropes, because the guys, you kind of form like such a strong bond. And so when you're coming from med school, it's kind of hard to get yourself into that bond. And so I just remember Ryan taking me under his wing and being a good friend in that way. Also, he's very respectful. I don't know if it's because we started at the same time and he kind of looked at me as equal, but I just remember that he always treated me with respect. And he always shared his cases with me, let me do half of it or all of it, or would really walk me through things, and he's a very good teacher. So I really appreciate that. Also, he's very laid back, and I think that we go through a lot of stressful times in residency, and he was always one to just kind of be the laid back person. And I think we really needed that balance with our program. in our day-to-day life. Also, I remember, I think this is one of the most common quoted things in regards to him. He would talk about his daily life as far as time with his little girls, and he always told, or not always, but once told us that he was changing his daughter's diaper, and he said, she quoted to him, she said, "You're a good girl, Daddy." And so we always jokingly say that to him when he does something good or kind of break the ice or whatever. We say, "You're a good girl, Daddy." And you know, it's like as residents coming in and being a junior resident, you form such strong bonds, and you're like, there's no way that another year could be as good as this year. It's just, I guess it's just crazy how strong a bond you can get, and I think that's one of the things that I'm going to miss. I never played like collegiate sports or anything, but I always remember that the most times I'll remember are the bonds between the guys, like on the bus trips and stuff like that for sporting events. And I think that's what I'm going to miss most about y'all, is just how much we worked, how hard we worked, but how much we cut up each day and how fun we made it. I never once came in and wishing I wasn't there or dreading coming in. It was just always a fun atmosphere, and so I just really appreciate y'all providing that. Just a few things that I'm going to remember about Ryan is that every now and then he would ride his bike to school. He kind of started this towards the end of his residency. He was trying, I think, to lose some weight and stuff like that, or felt guilty or something. I don't really know, but he started doing it. And then there's this one day where his bearings went out on his bike, and so it became a resistance bike, and he tried to go 7 miles to his house, and it wasn't working out too well for him. The next thing, he's always brought to Bojangles in the morning. He was do the buy one get one free and give someone a biscuit, and so I always appreciated that with him. And then he would always have stories of his family and his daughters, kind of break the ice with everybody. And then he also brought in the technique of sous vide cooking to a lot of the residents, and so I really appreciate that. And I'm going to miss y'all, and thank you so much.
I'm going to keep this brief here. I had to write some stuff down so I didn't continue to ramble. But my name is Chris Coons, for those of you who don't know me. I've known Ryan for the past 4 years, and I've known Clayton and John for the last 10 years. John and I worked together the longest. John has a great sense of humor. He's fun to be around. He's an excellent mentor. I appreciate John's debriefings after our surgical cases. He went out of his way to make sure that I learned the most from each case that we did. I appreciate that. Clay, I appreciated my time working with you. Anytime I had a question, you always knew the right answer. You have a great sense of humor, which is matched equally by your work ethic. And I know Banner is very proud of you. Ryan, the way the rotation schedule worked that they talked about, I didn't have a rotation with Ryan. We weren't paired together all year, and I only operated with you when we had emergency infection patients. And the word must have gotten out that Ryan was fantastic at treating odontogenic infections because patients would always seek him out. You're an excellent cook. We've been living together for a little while now, and I hope Mary has picked up a few of your cooking tips. I wish the three of you the best. You all leave very big shoes to fill. In Clay's case, big boots to fill. Thank you all for being great chiefs.
Okay.
Thank you, gentlemen. Mike Abraham, where are you, bud? Okay, so as is tradition, we have put together a little slideshow / movies that kind of cap off the year, and some of this will be some inside jokes, so just laugh along when everyone else is laughing, please. And Mikey, go ahead.